So hello everyone, my name is Ogini, and today I will be presenting my research on the impact of telemedicine on emergency visit expenditure among Medicare beneficiaries. Medicare expenditure in year 2024 was an estimated 1.12 trillion, and this is projected to increase to 1.9 trillion by the year 2033. This therefore constitutes a healthcare expenditure crisis, and emergency department visit is not to be a major driver. Telemedicine utilization expanded exponentially during the pandemic, and this was facilitated by some regulatory flexibilities. There's also been lots of research on telemedicine utilization. However, the relationship between telemedicine and emergency visit patterns remains unclear. This information is important because it would inform Medicare telehealth policy decisions and also resource allocation. This study was a retrospective cohort study where we utilized the Medical Expenditure Panel Survey data. This data is a nationally representative data set of non-institutionalized US adults. It's a public use file, and it's administered by the Agency for Health Research and Quality. We utilized the longitudinal panel 27, as well as the office-based visit file from 2022 to 2023. Our population was Medicare beneficiaries, and we had a sample size of 1,751 unweighted, and after applying survey weights, we had 53 million participants. We conducted an a priori power calculation and had 80% power for this study. Our key variables, our exposure was having at least one telemedicine visit in the baseline year, which is 2022, and our primary outcome was total emergency visit expenditure. The secondary outcome was number of emergency visits, and we had covariates including sociodemographic, economic, and health-related variables included in all models. Briefly describing our population, we had majority who were females, majority who were below 75 years, a large proportion was white, and we also had more individuals who had high school education and below. Individuals who utilized telemedicine in this population was 9.3%. We carried out the two-part model for healthcare expenditure data, which is made up of the participation decision model and the amount decision model. So the participation decision model was conducted to evaluate the impact of telemedicine on having an emergency visit expenditure. In this study, telemedicine did not significantly predict having an emergency visit expenditure, but we had variables such as marital status, age, and self-reported health status that were statistically significant. Marital status, individuals who were married had lower odds of having an emergency visit expenditure, while for age, individuals who were older had higher odds of having an emergency visit expenditure. We also controlled for other variables such as race, region, income level, BMI, self-reported health status, as earlier mentioned, and insurance type. For the amount decision model, we found that individuals who utilized telemedicine had an average annual emergency visit expenditure that was $861 US lower than those who did not use telemedicine, and this was significant. Also, individuals who reported good and poor health status had higher emergency visit expenditure compared to those who reported excellent health status. The key findings in this study is that telemedicine significantly reduced emergency visit expenditure among those who had an expenditure for the follow-up year. Looking at the secondary outcome for this study, telemedicine did not significantly predict emergency visit frequency. So what does this mean? It means that individuals who use telemedicine either had earlier interventions or better chronic disease management through telemedicine, which then led to overall disease burden reduction, or rather overall disease burden being better controlled, and ultimately them having less resource-intensive interventions. In conclusion, telemedicine shows great promise through this research for reducing emergency visit expenditure, and this is important in informing policy decisions, especially concerning the permanent extension of Medicare telehealth flexibilities. But there is need for further research in terms of clinical context and long-term sustainability. Thank you so much for listening. I would like to appreciate my team And please send your questions to my email. Thank you so much. Bye-bye.